Muito bom dia a todos. Anuncio a entrada do presídio nesta sala. Por favor, peço que se levantem. Muito obrigada, podem se sentar. Uma vez mais, muito bom dia. Com a permissão do presídio, dou início a esta cerimónia. Sejam todos muito bem-vindos à reunião anual da Associação Internacional dos Institutos Nacionais de Saúde Pública, IANPHI, que este ano se realiza em Moçambique, na cidade capital, Maputo. E sob o lema O papel dos Institutos Nacionais de Saúde Pública na promoção de sociedades saudáveis, equitativas e resilientes para enfrentar ameaças atuais e futuras. A todos os presentes neste evento vão os nossos agradecimentos, na expectativa de que este alcance as vossas expectativas. A cerimónia de abertura será composta pelos momentos que se seguem. Teremos a intervenção do excelentíssimo senhor Dr. Eduardo Samugudo, diretor-geral do Instituto Nacional de Saúde. De seguida, teremos a intervenção do excelentíssimo senhor professor Duncan Selby, presidente da IANPHI. E depois do excelentíssimo senhor Dr. Severin von Schilander, diretor da OMS em Moçambique. Teremos a seguir o discurso de abertura, que será proferido por Sua Excelência Dr. Hussein Isse, Ministro da Saúde de Moçambique. Passaremos então às intervenções-chave a serem proferidas pelo excelentíssimo Sr. Dr. Chikwe Ikwazo, Diretor Regional da OMS para a região africana, cuja intervenção será virtual. E, finalmente, por Sua Excelência Diretor-Geral do África CDC, Dr. Jean Cancea. Neste momento, gostaria de convidar o excelentíssimo senhor Diretor-Geral do Instituto Nacional de Saúde, Dr. Eduardo Samugudo, para usar da palavra.
I did not hear anything. I was concerned. I thought you did not have your breakfast. Now I am happy. So, Sua Excelência, Ministro da Saúde de Moçambique, Sua Excelência, Senhor Diretor-Geral do Centro Africano de Prevenção e Controle de Doenças em África, Sua Excelência, Diretor Interino da Organização Mundial da Saúde para a África, Excelentíssimo Senhor Presidente da IANPHI, Associação Internacional de Institutos Nacionais de Saúde Pública, Excelentíssimos Diretores e Presidentes dos Institutos e Agências de Saúde Pública, Excelentíssimos Representantes dos parceiros de cooperação aqui presentes, distintos convidados, minhas senhoras e meus senhores, permitam-me, em primeiro lugar, como a instituição organizadora, desejar boas-vindas a Maputo e a Moçambique, a todos presentes nesta reunião. Este agradecimento é especial a todos aqueles nossos convidados que tiveram que fazer várias horas de voo intercontinental ou intracontinental para nos honrarem com a sua presença. Este é um momento histórico de saúde pública a nível global. Por isso, esta reunião também é histórica. Sendo um momento histórico e a reunião histórica, as nossas discussões também são históricas e vão ficar para a memória. Esta reunião conta, Sua Excelência, Senhor Ministro, com a presença de cerca de 200 participantes, sendo mais de 100 participantes em formato presencial. Senhor Ministro, este é um número também histórico quando comparamos com outras reuniões. Temos aqui presentes mais de 60 países, ou seja, mais de 60 institutos ou agências de saúde pública a nível mundial. Estes números são um testemunho não apenas da dimensão, da importância e da relevância desta reunião no panorama de saúde pública a nível global, mas, acima de tudo, demonstra a qualidade dos debates que se antevê durante esta reunião. Por isso, temos muita expectativa em relação aos resultados deste evento. As boas ideias não devem ficar no papel. Elas só são úteis quando resultam em transformações e em ações para a melhoria da qualidade de saúde das nossas populações. Por isso, no final desta reunião, será elaborada uma declaração, Senhor Ministro, que é a Declaração de Maputo sobre Saúde Global. Esta declaração será dirigida a todos os atores globais, regionais e nacionais de saúde pública. E a mesma representa um instrumento fundamental para assegurar que as propostas que serão aqui discutidas e avançadas sejam materializadas em forma de compromissos e em formas de ação. Esse é o nosso compromisso, Senhor Ministro. À margem desta reunião serão realizadas também outras reuniões, que é a reunião no dia 11 de abril, que é a reunião da Assembleia Geral das Redes dos Institutos Nacionais de Saúde Pública da Lusofonia e duas outras reuniões de redes regionais de colaboração entre institutos nacionais de saúde pública. Isto engrandece ainda mais este evento e reforça a dimensão deste evento como uma força de colaboração em saúde global. Para terminar, permitam-me fazer agradecimentos. Não posso terminar a minha intervenção sem agradecimentos. Gostaria primeiro de agradecer pela confiança depositada ao Instituto Nacional de Saúde Pública de Moçambique para organizar uma reunião desta importância e desta dimensão. Esta escolha So, Dr. Gian Casseia, diretor-geral da Centro Africano de Prevenção e Controle de Doenças, já junta-se a nós. Seja bem-vindo. Welcome, Dr. John Casseia. So, we know that you just landed. Desculpa. Nós sabemos que I will speak in English because I see that you don't have headphones. We just know that you just landed this morning. We just landed a few minutes ago, and you had to rush across the traffic, the heavy traffic of Maputo. So thank you so much for joining us and for rushing straight from the airport to this meeting. So this shows the importance that you give to this meeting. So I apologize, I spoke in English because of... Então, continuando a minha intervenção, queremos agradecer à IANPHI, mas também a todos os membros pela confiança que foi depositada ao Instituto Nacional de Saúde de Moçambique, Saúde Pública, ao Ministério de Saúde de Moçambique, para organizar evento de tamanha dimensão. Queremos agradecer ao secretariado da IANPHI, queremos agradecer à Organização Mundial da Saúde, ao Centro Africano, ao África CDC, Centro Africano de Prevenção e Controle de Doenças, pelo apoio prestado durante esta jornada. Não foi uma jornada fácil. Foi uma jornada cheia de desafios, Sr. Ministro. Tivemos muitos desafios para organizar esta reunião, devido às transformações no contexto global de saúde pública. Mas estávamos determinados, Sr. Ministro. Estávamos determinados que, pelo facto de enfrentarmos uma das maiores crises de saúde global, esta reunião deveria acontecer e deveria acontecer na data planificada e em formato virtual. E conseguimos fazer isto. Queremos agradecimento especial. Antes disso, dizer que esses desafios mostraram que é possível movimentar montanhas. E nós conseguimos movimentar essas montanhas para que esta reunião acontecesse hoje no formato presencial. Agradecimento especial ao comitê do programa, que dedicou horas incansáveis para produzir um programa robusto, um programa de qualidade e, acima de tudo, um programa ajustado aos desafios presentes e futuros de saúde pública ao nível mundial. E obrigado pela atenção dispensada.
Muito obrigada, doutor Eduardo Samgudo. Gostava neste momento de convidar o excelentíssimo senhor presidente da IANPHI, Dr. Duncan Selby, para a sua intervenção. Dr. Duncan?
Bon day, everyone. Good morning. My first thought was me. Is it me? Hello, and thank you. Thank you, Dr. Eduardo, and Your Excellency. We had a wonderful conversation just before coming in this morning. Thank you. And to Dr. Jean for being here. It's been a very great pleasure to watch the journey of Africa at CDC and its impact, not only in the continent, but worldwide. IANPHI is honoured to be here in Mozambique, and we're honoured to have Mozambique as a member of IANPHI. We are getting stronger all the time. We are now 128 members in 107 countries, and the point of IANPHI is as relevant as it was today, maybe more so than when we were first formed 20 years ago, which is to be a peer-to-peer network of the leaders of government-based public health entities. We exist to be there for each other. We exist to share experience, expertise, and to be practical and present in the world, and to be there for each other. We are not universities or think tanks or any other form of public health enterprise. They matter, but we matter uniquely in that we are the only network of the government agencies, the leaders of the government agencies worldwide. And if ever a time when we needed each other and to be there for each other, it's now. It's not just in a post-pandemic environment, but in a changing world. And there's much uncertainty, there's fear, there's a great deal of loss felt about the resourcing, reductions in the financing, not just in the US, but around the world. But these are moments where we don't look and we think, well, what can we do? There's so much we can do. These are opportunities. Today and tomorrow is our opportunity to reflect on what's happening in each of our jurisdictions, but also where we can be strengthening, where we can be stronger together, where we can benefit and support each other and come to the fore with the true and only purpose of IANPHI, which is how do we support governments, support our ministers in protecting and improving the health of the people. And how can we, as National Public Health Institutes, contribute to that? We're not the only people that matter, but we do matter. And we're the conscience of the public's health. And however we organise in every part of the world, what matters is how do we deploy against the essential public health functions that matter to the health and well-being and the best possible health outcomes for people right across the world. There can be no good health. There can be no good health without good mental health. We cannot protect the health of our people unless we're concerned with the general health of our people. And so as public health entities, national public health institutes, where we have mandates to be concerned with protecting and improving. We need to be concerned with the health of our people in all these different dimensions. And the programme over the next 2 days plays to this wider agenda that we have as public health entities. I'll end with my thanks, my sincere and heartfelt thanks to our friends in Mozambique, to the government and to the President of Mozambique. I've asked His Excellency the Minister if he would convey our warmest thanks to the President for having us here for these 2 days, to Dr. Eduardo and his team, because we are very honoured to have Mozambique. I've said it once, I'll probably say it 6 times, Minister, in the course of the next two days. But you should be very proud of your National Public Health Institute because we are. And again, Jean, to have you here with us is a great honour. We have many members in Africa and many members that make contributions from Africa to many others around the world, and increasingly so. And to you for being here and for making the next 2 days the best possible time together, and to get to know new friends, to renew old friends. And as Dr. Eduardo said, at the end we'll present a statement from Maputo, which will be communicated throughout the world from our 2 days here together. Thank you, and thank you again, Minister. Thank you.
Muito obrigada, Dr. Duncan Salby. Neste momento, convido o excelentíssimo senhor Dr. Severino von Schilender, representante da OMS em Moçambique, para usar da palavra.
Sua Excelência, Dr. Ucenice, Ministro da Saúde da República de Moçambique, Excelentíssimo Dr. Eduardo Samogudo, Diretor-Geral do Instituto Nacional de Saúde, e Excelentíssima Doutora Geral Adjunta, que são os anfitriões deste evento, Professor Duncan Selby, President of IANPHI, Dr. Jean Kazaya, Director General of Africa CDC, Dr. Chikwe Ihekwezu, Acting Regional Director of WHO for the African region, who is connected by video conference. Ladies and gentlemen, all protocol observed. I'm sorry I prepared my speech in English, so my apologies to all my Mozambican friends and colleagues. Nevertheless, bem-vindos e bem-vindos a todos vós a Maputo, em Moçambique. Bienvenue à Maputo, welcome to Mozambique. It is an honor to speak here on behalf of the World Health Organization, notably the WHO Country Office to Mozambique, which is a long supporter of the National Institute of Public Health in Mozambique. Yesterday, when I was reflecting what I should say as WHO country representative in Mozambique to this erudite audience, and before the keynote speech of my proper boss, I felt a little bit intimidated. The theme of this conference is the role of national public health institutes in promoting healthy, equitable, and resilient societies to tackle current and future threats. There's probably very little on this subject that all of you don't know already or haven't thought about already. So I decided to share with you 2 personal experiences of my almost 30 years of career as a public health official with the World Health Organization, in which public health institutes played a key role. The first brings us back to 2003, at the time shortly after the emergence of the first SARS coronavirus in Hanoi, Vietnam. I was involved in an outbreak investigation of a suspected cluster of acute respiratory infections in Ratanakiri province, which borders Vietnam. The investigation team was led by the Ministry of Health Department of Communicable Disease Control and included representatives of Institut Pasteur of Phnom Penh, the US Center for Disease Control and Prevention, and WHO. At that time, Cambodia was still in the reconstruction phase, 12 years after the end of a terrible civil war and genocidal regime that lasted for more than 30 years. The country had a relatively young national public health institute that focused more on the training of public health practitioners and was not directly involved in outbreak investigation. Luckily, the outbreak in Ratanagiri was a false alarm. It was not SARS-CoV-1, and the country was spared from this disease in general. The second experience was in 2020 in the Central African Republic in the early stages of the COVID-19 pandemic. At that time, the country didn't have a National Public Health Institute and still doesn't have one, at least as far as I know. The functions of an NPHI were shared between the Ministry of Health, the National Laboratory, and the Institut Pasteur of Bangui. There was very good collaboration among these three institutions and with WHO, together and with international support, notably in this case China, we were able to set up rapidly to test for SARS-CoV-2 and to shape the early response. I'm sharing these two experiences to stress 2 points that I believe are vital for NPHIs to fulfill their role in promoting healthy, equitable, and resilient societies and tackle current and future threats. One is strong national institutions with clear roles and responsibilities. The second is international cooperation. And I was pleased that the discussions we had this morning informally before entering this room were exactly many people making the same points. One lesson learned from COVID-19 pandemic is clearly that countries with solid national public health institutions that were directly involved in political decision-making to control the pandemic managed better than others. NIPHs play a key role in this, but they are not the only ones occupying the space. In many countries, the functions that in other countries are covered by one NIPH are spread across Ministry of Health departments, NIPH and/or national institutes or centers for health promotion. There's probably no one-fits-all solution. Every country needs to define this for themselves. Yet, I've come across many countries where the roles and responsibility of the different entities involved are not clear and partially overlap. This leads to inefficiencies and unnecessary duplications. In times when the value of science to guide decision-making is put into question, more than ever we need to have strong institutions that are capable to generate the scientific evidence to guide decision-making at the policy level and to put them into practice. I've also stressed the importance of strong national institutions because COVID-19 pandemic has also clearly shown how much low and middle income countries depended on assistance from abroad. This is particularly the case in Africa. In order to have strong NIPH, countries need to invest in them. It is not sustainable to have them financed exclusively or predominantly by external partners. Yet, even with strong national institutions, international cooperation remains vital for public health, and NIPH play a key role in this. Without cooperation, exchange of information and tools among each other, and with regional and global collaboration, global international public health institutions, they won't be able to fulfill their role either. So institutions like Africa CDC, the World Health Organizations are key. No country, I repeat, can make it on its own. The IANPHI annual meeting is a very suitable platform to establish and consolidate international cooperation for public health. I wish you fruitful deliberations and a pleasant stay in the wonderful city of Maputo. Muito obrigado.
Muito obrigada, Dr. Severino. Neste momento, tenho a elevada honra de convidar Sua Excelência Dr. Hussein Isse, Ministro da Saúde de Moçambique, para proferir com o discurso de abertura.
Bom dia, good morning, assalamu alaikum wa rahmatullahi wa barakatuh. See Muslims here, brothers. Sua Excelência, Senhor Diretor-Geral do África CDC, Sua Excelência, Senhor Diretor Interino da Organização Mundial da Saúde para a região da África, Excelentíssimo Senhor Diretor-Geral do Instituto Nacional de Saúde de Moçambique, Excelentíssimo Senhor Presidente da Associação Internacional dos Institutos Nacionais de Saúde Pública, IANPHI, Excelentíssimos Senhores Diretores dos Institutos Nacionais de Saúde Pública, Excelentíssimos Senhores Representantes de Parceiros de Cooperação, distintos convidados, minhas senhoras e meus senhores. Permitam-me, em primeiro lugar, em nome do Governo de Moçambique, e em meu nome próprio, endereçar a todos os presentes neste encontro as minhas humildes e calorosas saudações de boas-vindas à nossa terra, Moçambique, nosso solo pátrio. Igualmente, gostaria de expressar a nossa satisfação, gratidão e a confiança, acima de tudo, pela escolha do nosso país para a realização desta grande reunião anual da Associação Internacional dos Institutos Nacionais de Saúde Pública. Como dizia o Dr. Samogudo, que o nível de participação desta reunião é grande e isto é um sinal de que Moçambique é acolhedor e Moçambique é gostado a nível internacional. Então agradeço a todos por terem colocado na vossa agenda Moçambique, que hoje é o centro do mundo para esta reunião. Esta reunião é de elevada importância na medida em que representa a maior e principal reunião global dos Institutos Nacionais de Saúde Pública de todo o mundo. Esta reunião, além de servir de importante fórum global de discussão e partilha de experiências sobre as ameaças presentes e futuras de saúde, também vai discutir o papel e a contribuição dos Institutos Nacionais de Saúde Pública na evidência de soluções para assegurar que o mundo esteja melhor preparado para enfrentar as ameaças presentes e futuras de saúde pública. Acho que os colegas percebem exatamente o que é que estou a transmitir, as grandes ameaças que o mundo hoje enfrenta de saúde pública. Vocês são a chave para ajudar nas soluções resilientes e construtivas para ultrapassarmos esta situação. Distintos convidados, a presente reunião realiza-se num dos momentos mais preocupantes e desafiantes de saúde global das últimas décadas, devido à ocorrência simultânea de múltiplas crises, das quais gostaria de destacar algumas. Primeiro, as mudanças climáticas e o aquecimento global, o rápido crescimento populacional em África, o aumento de conflitos armados a nível global, o surgimento de tecnologias disruptivas e a redução do financiamento global para a saúde e o aumento das desigualdades sociais e o supernacionalismo que ameaça a solidariedade global e a saúde pública. Estes fatores condicionam o surgimento de emergências ou agravamento de diversas doenças com consequências diretas para as comunidades. Aumentam o fardo de doença para o setor de saúde, resultam no aumento da frequência e gravidade de surtos e epidemias. Os países de baixa renda são os mais afetados por estes fatores, mas também são os menos preparados e com sistemas de saúde mais frágeis. Por isso, Moçambique defende reformas urgentes nas agendas globais de saúde, de modo a assegurar que a cooperação multilateral seja orientada para o esforço dos sistemas nacionais de saúde e na edificação de sistemas de saúde resilientes às várias crises globais. Face a estes desafios, defendemos que o uso de evidência científica ou inteligência científica assuma um papel-chave para perspectivar um futuro melhor para a saúde global. Por isso, devemos apostar nos Institutos Nacionais de Saúde Pública como pilar-chave nessa jornada. Distintos convidados, apraz-nos constatar que a presente reunião tem como lema o papel dos Institutos Nacionais de Saúde Pública na promoção de sociedades saudáveis, equitativas e resilientes para fazer face às ameaças atuais e futuras. A escolha deste lema reconhece o papel fundamental dos Institutos Nacionais de Saúde Pública na identificação de soluções tecnológicas e científicas para a melhoria da saúde e o bem-estar das populações. Neste momento particularmente desafiante da história da saúde global, defendemos fortemente que todos os países devem possuir um Instituto Nacional de Saúde Pública operacional como estratégia-chave para garantir mais e melhor saúde às nossas populações. É dentro deste contexto que o governo de Moçambique, através do Ministério da Saúde, tem vindo a fortalecer o nosso Instituto Nacional de Saúde, através do aprimoramento dos seus instrumentos legais, provisão de mais recursos, conferindo maior capacidade técnico-científica, administrativa e financeira. A título de exemplo, nos últimos 4 anos, Moçambique expandiu a representação geográfica dos Institutos Nacionais de Saúde, dos Institutos de Saúde Pública, e estabelecemos laboratórios de saúde pública em todas as províncias do nosso país, sendo que o último será inaugurado no final deste mês na província de Gaza. Quero aproveitar esta oportunidade para saudar pessoas que contribuíram para isto. O Dr. Ilé está aqui, Dr. Samugudo e todos os outros. Queria pedir uma salva de palmas para isto. Pretendemos que o Instituto Nacional de Saúde de Moçambique seja um modelo a ser aplicado na região e no mundo. Fruto destes esforços, recentemente, o África CDC elegeu o nosso instituto como um dos centros de excelência para o continente africano. Merecemos uma salva de palmas. Por isso, também estamos satisfeitos que esta reunião vai abordar de forma estruturante as estratégias para o fortalecimento e consolidação das redes de colaboração internacional para o fortalecimento dos Institutos Nacionais de Saúde em todos os países e a nível global. Distintos convidados, registramos com muita satisfação a diversidade e importância estratégica dos temas que serão objeto de discussão ao longo destes 3 dias de reunião em Maputo. Estamos particularmente expectantes em relação às discussões sobre as mudanças climáticas, porque Moçambique, como sabem, é um dos países mais afetados por estes eventos climáticos extremos, ocupando neste momento a 5ª posição entre os países mais afetados a nível global. Apenas nos últimos 3 meses, o nosso país foi devastado por 3 ciclones tropicais. Em 3 meses. Imagina a destruição. Nomeadamente, os ciclones Chido, Diquilede e Jude, com impacto severo sobre o nosso sistema de saúde e nas comunidades. Convidamos a todos os participantes no sentido de se engajarem de forma aberta e franca nos debates que terão lugar em diferentes sessões, colocando a vossa experiência e saber, inteligência científica ao serviço da saúde pública global. Teremos aqui a Declaração de Maputo, que será um instrumento importante que iremos também aprimorar e dar seguimento nos próximos tempos. Gostaria também de convidar a todos que aproveitem este país belo para desgustar da nossa gastronomia, da nossa cultura vibrante e das belezas da nossa cidade de Maputo, que vos oferece. Por isso que escolheram Moçambique, pois colocaram Moçambique na vossa agenda. País acolhedor, um país amigo, e isso nos orgulha de receber esta reunião aqui na nossa terra e no nosso solo pátrio. Alguns de vós não querem sair mais de Moçambique, porque é um país lindo e interessante. Com estas palavras e sobre o lema, o papel dos Institutos Nacionais de Saúde Pública na promoção de sociedades saudáveis, equitativas e resilientes, para fazer face às ameaças atuais e futuras, declaro aberta a reunião anual da Associação Internacional dos Institutos Nacionais de Saúde Pública em Moçambique. Tenho dito e muito obrigado pela vossa atenção. Thank you very much. Shukran jazilan.
Excelência, muito obrigada. Gostava, com a permissão de Sua Excelência, Ministro da Saúde e do Presídio, passar as intervenções chaves. Para o efeito, convido o excelentíssimo senhor Dr. Chikwe Kwezem, Diretor Regional Interino da OMS para a região africana, para proferir da palavra. Esta intervenção será virtual.
Good morning. Can you hear me? Can someone confirm you can hear me in the room?
Yes, yes, Dr. Chikwe, we can hear you.
Okay, thank you very much. Good morning, bon dia, Mozambique. Mr. Hussein Isse, the Minister of Health of Mozambique, good morning. My dear friend and mentor, Duncan, our president in IANPHI, good morning. My brother Eduardo, amazing that you're hosting this conference in Maputo, and I hope that my other brother Ilesh, who preceded you on this position, is also somewhere in the room. Our representative in Mozambique, Severin, and of course my brother, the DG of the Africa CDC, Jean Casser, really an honor and a pleasure to speak before you. So, bon dia, greetings from our Director General, Dr. Tedros Ghebreyesus, who knows I'm speaking to you this morning. Of course, he's in the middle of managing a very complex global situation, but it's where we are. We do it with pride every day. But for me personally, there's nowhere in the world I'd rather be this morning than in Maputo. It was on a cold Monday morning in October 2001, that I walked into the premises of the Robert Koch Institute for the very first time, and which started 20 years of my career invested in public health institutes, public health agencies in Europe, on the continent, is where everything I know has come from. And until the call came from Dr. Tedros in 2021, all I'd ever known was working in the context of MPHIs. And so it's in that context that I offer you a few words today, reflecting on the past, trying to shape the present, but also with you, hoping to define some of the future. Next slide. Unfortunately, the present that we face, next slide, the current situation is that we are faced with emergencies, whether we like it or not. And they seem to be increasing, whether this is in conflict or driven by infectious diseases, new ones, old ones. This is the reality of the world that we live in. And yes, a lot of the attention of national public health agencies is around the response to infectious disease threats. But increasingly, we are also responding to many humanitarian crises, to crises driven by conflicts. And so a lot of the time that I spend in the emergencies program at HQ, but also in WHO Afro, is in dealing with the health consequences of conflicts in South Sudan, in the Eastern DRC. Most of our time working in this space is now also occupied with these conflicts and humanitarian crises. So whether it's a cyclone in the north of Mozambique or floods in West Africa and the consequences of that, as leaders, we cannot say that our bread and butter is working only on infectious diseases. So at the moment, as we speak, there are 38 graded emergencies that the World Health Organization is responding to, and 18 of them are on the continent that we call ours. So whether we like it or not, most of our work will be preoccupied with dealing with these challenges. Next slide. But there is some good news. And the good news is really in this map. National public health agencies are increasing around the world. It's an incredible phenomenon. You know, it's like the world has woken up to something that many of us have been preaching for many years. So from just 54 national public health agencies in the year 2000, we are close to 100. We're at 94 national public health agencies currently. This is an incredible number. In the African continent, where we are at the moment, 2 out of 3 countries have a national public health agency. Yes, they're not all perfect. Yes, some of them are struggling to assert themselves, but I am convinced that there's no other way. There is simply no other way we can effectively respond, build capacity, sustain the capacity within the system other than an institutional framework within which this happens. So I am really pleased that we are slowly winning over hearts and minds across the continent. We're winning over the minds of our ministers, we're winning over the minds of our government, and I have absolutely no doubt about it. In the next few years, the question will not be, do we have a national public health agency? The question will be, how effective is our national public health agency in defining, determining the future of health emergency preparedness and response in our countries? It will be as clear as a country having a central bank in its financial sector, as well as a Ministry of Finance. It will be as clear as a country having a military, as well as a Ministry of Defense. The distinguishing factor between what a national public health agency does in defining the operations of public health will be as clear to the world as a distinguishing set of responsibilities from a Ministry of Health. It is clear to me, it is clear to everyone in this room, and I'm sure very soon it will be clear to everyone in the world. But it will not happen on its own. Next slide. It will only happen if we define this. The reality is that many of our national public health agencies came to being out of a crisis. That is generally the big impetus that has driven the emergencies, the emergence, and the socialization of what a national public health agency can be and should do. Within the World Health Organization, in 2014-15, after the Ebola outbreak, we came to the conclusion that we cannot deliver on the several components of emergency preparedness and response without a single accountability framework. It is not that WHO was not doing all these things in the past. It was that we did not have a single accountability framework that brought it together. And so this was the biggest lesson out of the Ebola outbreak. And out of that, the World Health Organization's Health Emergencies Program was born with an executive director with clear and very specific mandates given by the Director General of the organization. And since then, we have had a single program across our 3 levels, HQ, region, and country offices that support our member states in predicting, preventing, preparing, and responding to health emergencies. Out of the COVID pandemic, we developed a new framework, a new health emergency preparedness and response framework that now defines both the governance, the systems, and the underlying financial foundation on which we can build our health emergency preparedness and response activities. Next slide. Out of this, we have defined 5 foundational functions that every response should have as we think about it. So the first, obvious, is emergency coordination. I think the importance of this is self-evident. Every country now has an emergency operations center. That EOC is best placed within a national public health agency because you have the mandate, you have the operationalization of it, and has become critical. And we have been developing this year for the first time. We're experimenting successfully with coordinating with our sister agency, the Africa Centers for Disease Control, in emergency coordination on the African continent for significant outbreaks of mpox. Very important new collaboration, new way of working, and thanks very much to the DG for supporting and driving this. But the instances where WHO will come together with Africa CDC to form an incident management structure will hopefully be very few, because most of the cases will be responded to by yourselves. Leaders of national public health agencies detecting small incidents, responding to them in your own countries, led by an EOC in your own national public health agency, where we are there to support, but we are not there to lead. You lead, you respond, and that's the work that NPHAs do every time, every single day. Next slide. In addition to emergency coordination, we have also defined a new concept called collaborative surveillance. When we started talking about collaborative surveillance, many people asked, what is that? What is this new term? How will we define this in contrast to everything else we do? But collaborative surveillance has become even more self-evident in the last 2 months as the investments into the vertical surveillance system that we've held so dear is disappearing overnight, literally. So the case that we've been making that we cannot continue building single systems for single diseases and laboratory infrastructure for single diseases is now self-evident because the money is disappearing. So it's no longer do we want to collaborate. We have to. We have to use the platforms that we're building for all diseases. We have to use the labs that we're building for all diseases. They're human resources. We cannot have a TB surveillance officer, a HIV surveillance officer, malaria surveillance officer. For what? So finally, the penny has dropped and we have to come together. And that's the notion of collaborative surveillance. We're not integrating everything, but we're saying if you have a piece of molecular equipment in your lab, you should be using this to do mpox, to do yellow fever, to do whatever other disease you want to detect. We have to use these resources more efficiently. There's no other continent in where this is more self-evident than on our continent. And the goodwill that has led to the saving of many lives, but has also led to the extreme verticalization of our health systems has to stop. And we have to bring this together. And that's really what collaborative surveillance is about. Next slide. The next notion is on community protection. In a way, this is the most important thing that we all do. We build systems to protect communities. This is the reason for our existence. And including this as the core mandate of a national public health agency, irrespective of at what stage it is delivered on, has become more self-evident than ever before. Next slide. The next one that may not be immediately obvious to everyone working in public health over the past 20 years was the need for safe and scalable clinical care. In the past, we worked with the notion that ours was to prevent, to detect, and to manage a public health response. If there's one lesson we learned from COVID, it was that that was not enough. We cannot just expect a health system to respond to the clinical care requirements during a big epidemic or a pandemic. We also have to get involved. And that's why, together with many other partners around the world, we're defining new ways of delivering medical oxygen to health facilities, new way of ensuring that diagnostics are available to detect diseases that are important, and new ways of managing patients efficiently. And this has become part and parcel. Not that we in public health will be delivering the clinical care, but we have to define the models of delivery that are suitable for the situations that we work in. Next. And finally, on access to countermeasures. Now, I'm not going to spend the next few minutes with you talking about the pains that we went through during the COVID pandemic, or some of the few successes that we have had since then. But right now, in Geneva, in the headquarters of the World Health Organization, probably the most important conversations in our lifetime is happening. Member states of countries around the world are sat together in the last week of negotiations to agree or not agree on a new pact of solidarity. I sincerely hope that they recognize the moment that is before them and get together and sign that pact and give the world a new way of working, a new way of collaborating, a new way of supporting each other. And together with this, hopefully, we can define a new way of preparing and responding to epidemics and pandemics by making sure that the countermeasures that we produce are available to the locations and the people where it is needed the most at the times it is needed the most. So I hope that we will all gather again in Geneva for the 78th World Health Assembly in a couple of weeks and celebrate the leaders of our member states in a situation where they have come together and defined a new pandemic agreement for the world. And this will define the access to countermeasures that we so urgently need. So as I begin to wrap up, it's been an incredible time. Next slide, please. As in the World Health Organization, we are beginning to define some of the priorities for national public health agencies. We recognize the role of national public health agencies around the world, from South America to Europe to Africa, are playing in the future of how we do health emergency preparedness and response. Here in your conference are many colleagues that have helped us in defining some of the new norms and standards that will define the work that we're doing together, specifically on the emergency preparedness and response space. And we hope that by the end of this year, some of this work will be completed, and every country that wants to set up a new national public health agency or wants to redefine an existing one can pick up this new guidance coming out on how and what emergency preparedness and response functions need to be located and need to be supported within the remit of a national public health agency. Next slide. And this is the work so critical that is already happening, well advanced. It has defined a few foundational domains that every MPHA should have and a few technical domains to develop further. Many of you in this room have been contributing to this framework as consultations have happened in every region around the world. And in the next few months, we would ultimately have a document that a country can pick up from the Far East, the Far West, or any corner in the world, and at least have a piece of guidance from which they can start a process. Every country still has to define its own agency within the limits of its national norms, standards, its legal framework, its communities, its ways of governance. But ultimately, we will have collectively define a set of ways of working that hopefully will define how national public health agencies should work in a best case scenario. Next slide. In addition to that, we are documenting the various governance models, next slide, that exist already, recognizing that the governance of national public health agencies is also dependent on the governance of the countries within which they are located. And we're trying to adapt it, at least document this so everyone can read and understand what these are. And today we've done detailed deep dives into many countries, of 12 countries specifically around the world, of which 4 of them are on the African continent: Ethiopia, Rwanda, Algeria, and Somalia. And from what we have learned, we will document this very carefully for others to learn the processes through which they're evolving and pick up the pieces that they would like to pick up from. Next slide. In addition to defining new norms and standards, defining governance models, we're also bringing the agencies together. This is probably the most important of them all, because without a community, we are nothing. This is really building on the incredible success that IANPHI has created over many years of bringing us together. Even this annual conference, of which I have attended many, has created such an incredible sense of community. We can only support each other if we know each other and respect each other, and sometimes even love the work we all do together. And that's why building a community has been so important. And with many colleagues, we're bringing colleagues together across national public health agencies to learn from each other, to share experiences online, offline, to do peer visits, to build networks across North and South, East and West, recognizing that ultimately we're one humanity and we have to live and work within it. Next slide. So, how do we create the future? We live in very challenging times. There's absolutely no doubt about it. Everyone in this room recognizes the pain and the challenges that many of us are going through at the moment. We are confronted with a very challenging and financial environment, but even more critically, we're challenged with a narrative that goes at the heart of what we're doing today, at the heart of multilateralism, at the heart of the principle that I am here because you're here and you're here because I am here, at the heart of a spirit of collaboration that we have built over the last 40 years together. So everyone in this room today has a question to ask himself or herself. Do we hide under the tables and acquiesce to this new narrative? Or do we challenge it mentally, socially, and economically by our thoughts, our words, and our actions? I cannot answer for you, but I know what the answer is for myself. And I want to end with these 4 small conclusions. That we have to safeguard the progress that we have made. The progress that we have made is not only in the institutions that we have built, but it's in the community that we have built. The fact that many of us have modeled our institutions after others. And one of the most important institutions on which many of us have modeled ourselves is now being threatened in the context of the work it has done. And many of you are asking yourselves, if this country that we've all looked up to is challenging the existence of its most important institution in public health, what should we do that have modeled ours against theirs? So that's the question we all have to answer collectively and individually and define the steps that we take in the future. But I think that the vision for national public health agencies is as strong as ever. It is obvious from the number of people in the room today and the number of people that have joined online. Our responsibility is to deliver. The responsibility that comes with the privilege that we've been given, the privilege of building institutions, growing them, is to deliver on what we have been set up to do. Every time there's a new alert somewhere in some country around the world, We need to be able to tell the world that our National Public Health Agency has found the signal, has responded to it, and is reporting to the regional and global levels that may need to know because of the health of others. It is up to national public health agencies to run with this responsibility. Do not wait to be asked. Run with the responsibility. It's an opportunity to do that which we were set up to do. But finally, the hardest part for all of us is on collaboration. Many of you in the room would know that that is probably my favorite word, because it's probably the hardest thing to do. Working together every single day, pushing our colleagues to work together across national public health agencies, with regional public health agencies. If you're working at the national level, there probably is in West Africa, there's a West Africa Health Organization, there's the Africa Centers for Disease Control, there's the World Health Organization, all of them with very similar mandates to support the countries that we serve. How do we do this? It's a choice. Do we work together, or do we compete for the scarce resources around? This is a choice that any agency that I happen to be part of leading has to choose the path of collaboration. And I want to end with a very famous quote from a famous African author. I don't call him a Nigerian author because he doesn't belong to Nigeria. Chinua Achebe truly belongs to the world. And he says, when a man calls his kinsmen to feast, he does not do so to redeem them from starving. He doesn't do so because they don't have food in their own houses. He calls them together to eat because it is the right thing for kinsmen to do. On that note, I thank you very much for the opportunity to share a few thoughts with you on the future of national public health agencies. I wish you a fantastic conference. I wished I was there with you, but I am there with you in heart and spirit. So thank you very much. Thank you very much, Mozambique. Thank you very much, IANPHI.
Muitíssimo obrigada, Dr. Chikwe, por esta intervenção. Neste momento, tenho a elevada honra de convidar Sua Excelência, Diretor-Geral do África CDC, Dr. Jean Kaseya, para prosseguir com a sua intervenção. Por favor.
His Excellency, Dr. Hussein Isse, Minister of Health. You know, it's good to see a former National Director of Public Health becoming Minister of Health. I was talking with your president in Addis Ababa in February. I say it makes a lot of challenge and you have to deliver because you know the system. And I want to thank you also, my brother, for your support to the National Public Health Institute of Mozambique. My brother Samo was saying good things about you, and thank you for that. Dr. Chikwe, thank you for your speech. I think it's a tough time. Tedros and myself, we are talking almost every day, and we are trying to support each other. He represented me in Kigali for a meeting. I was in Abu Dhabi to represent him, and I'm here also to represent him, not as a WHO official, but because we need to work together. And he's supporting us for the Pandemic Agreement Treaty. This is why I'm not in Geneva today. I want to recognize Her Excellency Anna Nemba. I think she's somewhere. She's the ambassador of Mozambique in African Union. She flew to support us. And it's good to have this kind of ambassadors sitting in African Union and supporting our agenda. Thank you, Ambassador. I see so many friends, colleagues, even Abdullah, from Saudi Arabia. I know most of you. I don't want to go to provide names, otherwise all of my minutes given to me will. But let me recognize all of you. It's a great pleasure for me to be here. There is no other place I wanted to be if it's not here. Yesterday till 11 p.m., I had meetings in Qatar. On my way to the airport, my special assistant already negotiated with a barber. He said, you have a lot of gray hair, gray beard. You have to go to the barber. And this barber did it midnight, but I didn't pay. You know why? He took time to Google me. He said, you are saving the life of people in Africa. And this is my gift to you. I'm here for many reasons, but the first one, I was talking with His Excellency President Daniel Chapo, the President of Mozambique. I committed to come to see him, to visit him, to see what kind of support, additional support, Africa CDC must provide to Mozambique, because he has a clear vision how to strengthen the system, health system in this country. The second reason, this gentleman, Samo Gudo, he was making noise, fire. He said, DG, since you are elected, you didn't have time to visit Mozambique. Please come. And thank you for having people like you. If all African countries could be like that, I think things will move quickly. I hope my presentation is already there. While they are putting my presentations, colleagues, you are doing great job. It's a tough job that you have. And sometimes we need to celebrate ourselves. I didn't meet that person, but I wanted this opportunity to be a surprise for her. I wanted us to give a standing ovation for someone, a giant, someone who contributed a lot to science, to the advancement of science in the world. She's a good friend of mine. She's a good friend of Africa. I was informed that she's retiring very soon. And she didn't know that one of the reasons I landed here is to celebrate her. Colleagues, let us give a standing ovation to Dr. Teresa Tam from Canada. Dr. Teresa Tam. Dr. Teresa Tam, she's leading Public Health Canada, and she's retiring. When are you retiring? End of June. It means this can be her last meeting. Take time to talk to her. Thank you for coming here, Dr. Tam, please. Colleagues, we are here from African perspective to celebrate some success. Before COVID, we had only 13 countries with National Public Health Institute, 13, 1-3. After a few years, we managed to double that. We have 25 countries and 11 on track. This is a huge success. But this one is also correlated to the Public Health Emergency Operations Center and the capacity of genomic sequencing in all and each country in Africa. We believe that we need to maintain this success. But we cannot maintain this success with the current environment. As you know, official development assistance, we call ODA, is decreasing in Africa. Yesterday, I was talking to people in Abu Dhabi. I say, when we talk about a new era, each of us has a definition of new era. For us in Africa, new era means decreasing of ODA. But this decreasing is sudden. And We are losing mostly around 75%. I was thinking about 70%, but with this new announcement coming, almost all wealthy countries are cutting. And it's also because of low domestic resources, low level of domestic resources. And in addition to that, we have dependency on external countries for medical countermeasures. From one side, less resources, from another side, more outbreaks, as you will see. That is making our continent more fragile. That is opening the door for a pandemic made from Africa, while exposing our continent for 2 to 4 million additional deaths per year. This is just dramatic. And to give you a sense of what we are managing on a daily basis, from 2022 to 2024, we had 41% of increase in terms of outbreaks. In 2 years, 41%. And you'll see almost all regions in Africa were affected. This is why we need a strong network of national public health institutes working together. Colleagues, I come from a country where there are outbreaks almost every day. What I saw when I started my career almost 28 years ago, every day when there is a major outbreak, they were putting in place an ad hoc committee. When the outbreak is over, the committee is over. No institutional memory. Today, I hope people from DRC, they are here. Today, we have a National Public Institute leading the response. And this is what we need for all countries in Africa. But because we know that we need money to respond and to prepare to all of these outbreaks, we took time to analyze where are we with our national budget. Not more than 3 countries are on track to meet what we call the Abuja target of 15% of national budget dedicated for health. Worse, we have around 20 countries providing less than 5% of their national budget to health. In that context, how do you want to perform your NPHI? How do you want to perform the component of pandemic preparedness and response? We went far. We wanted to know why the target, the Abuja target, is not achieved. Then I saw only 16 countries in Africa, 16, out of 55 countries, have a national health development plan supported by the National Health Facility Financing Plan. The National Health Development Plan is giving you the vision where you want to go. The National Health Financing Plan is giving you how you can finance this vision. Then you understand, if you don't have these tools, how can you mobilize funds even internally? This is why I used the convening power given to me by head of state. I had to call several meetings and consultations. On the 13th of February, I called a meeting of all ministers of health. 52 out of 55 attended in Addis Ababa. This meeting was opportunity to discuss honestly and frankly, where are we with the domestic financing? Where are we with this dependence that we have vis-à-vis external resources? The day after, it means the 14th of February, I convened a meeting of head of state led by President Kagame, a small committee. This high-level meeting on domestic financing discussed some of the solutions that came from the ministerial meeting. From the 15th to the 16th February, we went to the African Union Assembly to vote and to decide on the way to move forward for more funding for Africa. Then I started to fly to meet a number of your ministers in Europe, in the US, World Bank, IMF, to discuss honestly and frankly with them on how we need to address the issue of head cut in the health sector and what is our plan in Africa. After these meetings, I had to debrief my boss. I will meet him again tomorrow because I'm flying tomorrow. Life doesn't give me luxury to spend 2 nights somewhere. I met the president of Angola who came to visit me on the 14th of March. The same day, I received also the Prime Minister of Ethiopia because I wanted them, on behalf of other head of state, to agree with us on the plan that we are putting in place. It's, for me today, the first priority that we have in Africa. And then, last week, after all of these consultations, 2 months of hard work, we released what we call Rethinking African Health Financing in a New Era. This document is available in Africa CDC website. Just go Google africacdc.org. You'll find it. You can read it easily. This document is around 3 pillars and a cross-cutting pillar. We need more domestic resources. I have to say to our ministers, and the Minister of Mozambique is here, I'm repeating that to him. I will discuss with the President of Mozambique. I will tell him the same message. The assistance as we knew before is dead. Dead. Now we need to rethink how we need to reorganize our health system to make sure that we are achieving our objectives. More domestic resources will start with having all countries with a strategic plan and a national health financing plan. That will be the tool for the dialogue. I will attend the spring meeting, World Bank, IMF, in a week in Washington. I already have a meeting planned with all Ministers of Finance of Africa to engage them on that. The President of Angola will call for a meeting of head of state in May. This is a consequence of head cut. That one is the way to move forward in Africa. The second pillar is innovative financing. Innovative financing means how can we create additional funds that are not coming from the national budget? And the third one is about blended financing. Oh, there is even fire. You see, when we talk about head cut, blended finance, it's okay, we can continue, colleagues, because I know the minister must attend the meeting in the parliament. Blended finance today is bringing investors coming in Africa making sure that we create conducive environment for that and we de-risk them. We need to accept to have the private sector investing in the health sector in Africa. And we need to give them space. But the most important one is what we call the cross. I think people who are sitting there, they can still see in that screen. The cross-cutting pillar. This cross-cutting pillar is mostly what we call the governance. Let us say the truth. A lot of wastage. I'm a former minister in my country. If I ask the minister today if he has control on funding coming in his country, I don't know if we can say that he has control. We want now to align donor funds to the vision of the country under the leadership of the minister. This is what we call the Lusaka agenda. We want also to cut corruption, to cut fraud, because we know in some of the countries, this is a major issue. And we want to move forward to achieve something tangible, the impact. I think all of these mechanisms, we are putting that in place. And today, Africa is moving toward more sustainable financing mechanisms. You will be ambassadors. Take time to read this document. Give us your feedback. Talk with your government if you are from some countries. Tell them, this is what we need to support in Africa today. Africa is not telling us, give us $80 billion that we are giving us in the past. No. For the past 50, 60 years in Africa, we created a system where countries were not investing because they were dependent on external funds. Now it's the end of dependency. Colleagues, with that, my last slide to you today. What is our vision for the next 5 years? We need to have all countries in Africa having a national public health institute because we'll make sure that we'll have resources. I give you a clear plan. And the plan I gave you is not what Africa CDC cooked. No. It's coming from a series of consultations, 2 months, around 26 meetings with various partners and colleagues, ministers, head of state. It's a solid plan that we have now, that we are leading. You cannot have a National Public Health Institute without having the Public Health Emergency Operations Center. How do you think it will work? You cannot have the Public Health Emergency Operations Center without having a strong, decentralized laboratory network. The minister is telling us, Mozambique now, you have labs everywhere. And I thank my brother, Duncan, for the wonderful job he's doing because he understands that, because he's providing support to that. Colleagues, the fourth component. I was talking with the Minister of Kenya. He was telling me, with some decisions made somewhere, they didn't have access to their data. We need to have a strong electronic and integrated, interconnected data management system. We don't want to hear again about disease X, as it was the case end of last year. For 3 months, no one knew about a disease that was in DRC. We're calling that disease X. Just because the lab system is not in place, just because the data management system is not in place. And the surveillance is weak because of that. Today, when we talk about Mpox, the testing rate of Mpox in DRC today is 18%, 1/8. despite all effort we are doing because of the insecurity in the eastern part of DRC. But because also infrastructures are not good and because the data management system is not appropriate. Without these four components, and around these four components, you have the human health workforce, you have financing, you have everything around that. If we achieve that in 2030, in the next 5 years, I can say I'm good for retirement. With that, I thank you.
Excelência, muito obrigada. Passamos agora ao momento cultural. Será exibido um ritmo tradicional do Moçambique, do sul do Moçambique, denominado Xigubo.